In this video, we're looking at taping for iliotibial band friction syndrome, commonly known as runner's knee. When patients present with lateral knee pain, it commonly comes from this structure on the outside, known as the iliotibial band. This band comes from a muscle called the tensor fasciae lata, comes down, and this band physically crosses the lateral femoral condyle as it inserts onto the Gerdy's tubercle. So if I'm just going to mark where patients commonly have a pain around that lateral femoral condyle, and we're going to put the leg into an adducted, slightly flexed position. So we lengthen in the IT band in this position there. So the kinesiology tape we're going to use is a longer eye strip, especially if I had pain to the patient in this lateral side of the leg. And then two smaller eye strips to offload and decompress the pain. So first one, so where the Gerdy's tubercle is located, just slightly inferior. So split the tape and then apply that first pad around that area. Try not to touch that part of the tape too often, like so. And then no stretch on the end. So pull so it breaks the back in. So peel that back to the first square. And then if you can, no stretch, but a little bit of stretch, otherwise it'll look funny when you apply it. So about 10%. And just mold that tape around the lateral side of his leg, all the way up along the IT band, like so. So we've lost where the pain is, so I'm just going to mark again with a slightly different colour star there. So we can see that the pain would present itself around this area. So we're going to use two small eye strips. So split one in the back, peel that one back, peel this one back to the end, turn it over, and then hold it, and then literally apply 100% back off to about 75 directly over the pain with no stretch on the ends. You can just feed them out. And again, with this one, so peel that back, go to the end, and the same on this side, and then turn it over like a plaster. Try not to go behind the knee because it will irritate when you run or cycle. So from there, 100% back off a little bit and cross the area of pain. So we can stick that bit down and feed her out, and stick that and feed her out. And then using the back of the tape, heat activate the glue. And again, we can leave her on for 3 to 5 days. And the patient would be happy to run or even swim with that tape on. There we have kinesiology tape in for iliotibial band friction syndrome.